Good evening and welcome to The Report with me, John Rees. Over 1 million people are now affected by the Ebola virus, according to the UN Health Agency. And even as experimental cures run out, health authorities are having to make tough choices about who gets treated. The rapid spread of the virus has raised concerns throughout the world. Representatives of the Gulf monarchies met in the Saudi capital to discuss precautions ahead of the annual Hajj pilgrimage due in October in Mecca. Sarah CA has this report.
A consignment of experimental Ebola drugs arrived in Liberia yesterday. The drug, known as ZMapp, will be taken to a hospital in the capital. It will first be administered to Liberian doctors, who officials said contracted the disease while attending to patients. The world's worst outbreak of Ebola has claimed the lives of 1,069 people, and there are nearly 2,000 probable and suspected cases. The vast majority of these are in Guinea, Liberia and Sierra Leone, while 3 people have died in Nigeria. The UN Health Agency says only around 10 to 12 doses of the drugs have been made, and this raises difficult ethical questions about who should get priority access. The doctors will be the first Africans to receive it, though it has been given to a Spanish priest who later died, and 2 US aid workers who are reported to have shown signs of recovery. Authorities are also concerned that ZMapp's unproven status could leave them open to the charge that humans are being used as guinea pigs.
For me, this is not the answer. It's just a matter of trial. We need to continue our contact tracing, our surveillance system. We need to continue the health promotion. We need to continue the mechanisms that will break transmission so that we eradicate this disease. By giving it drugs, it is not the answer.
Even so, the clamour for the experimental drug is strong, given that the contagious disease is killing more than half of its victims and there is no known cure or vaccine.
Yeah, but for us, we are pleased. If they assist us by giving us some drugs that will help us with the Ebola problem, well, we'll be happy. But we want to know the actual effect of it, whether it will really assist us or it will do more harm.
One of the epidemic's most tragic consequences is the toll on healthcare workers who rushed in as the first responders, only to become infected themselves due to inadequate protection measures. The World Health Organization said this week that 170 healthcare workers had been infected and at least 81 had died. Despite the stir caused by ZMapp, experts say that preventative public health measures will be crucial to containing the outbreak. The outbreak has brought fresh attention to efforts to find a cure. Scientists in the United States studying Ebola said that they have found how it blocks and disables the body's ability to battle infections, in a discovery that should help the search for potential cures and vaccines. Sarah Say, The Report.
Well, in the studio to discuss the issues raised by the Ebola virus is Ayo Johnson, a journalist specialising in African news and current affairs. Welcome to the programme. So how did we get to a place where there's very little vaccines for this virus? They're running out, and some of them are experimental. I mean, that's not a good place, is it?
Well, no, but we're in uncharted territory. Clearly, the Ebola virus has caught everyone by surprise. Not that the virus itself is new, but the speed at which it has happened this time around in urban areas, cut across 3 countries, in fact, even a 4th, including Nigeria, not to mention Sierra Leone, Guinea, and Liberia, and the numbers of people who are going to be affected. And of course, we know already that there isn't a known cure. So, hence, the protocols for the sort of drugs which are experimental right now are being forced and fast-tracked into the mainstream, hopefully, to get these to those who are affected.
And how come it has spread so fast? I mean, as you say, it's not new. How come the spread of it has been so rapid this time round?
Well, this is the strange thing about the virus. The last time it was mainly in rural areas, very much in a different part of Africa. This time it's West Africa. Again, it's urban-related. It's caused by close contact from bodily fluid and person to persons. Naturally, opticians and specialists alike have been able to track the virus back in terms of at least being isolating family members who've been in contact with those who've been affected. But it's still not enough. The virus seems to be able to creep in behind the closed doors and be able to affect far more people than would otherwise have thought.
So are you saying that there's something this time round that's to do with perhaps being prevalent in more urbanised areas than before?
That's the problem. That's the fear. Urban areas, more population numbers you're dealing with, faster movement of people, and that's why, in fact, there's a huge concern right now in Nigeria, the most populous country on the African continent, which has a huge population in the capital, not to mention in other cities. And if this virus takes hold in a place like that, then the worst scenarios are all open to play.
And what about the healthcare that's in place? Because we heard in Sarah's report that now the people, the doctors and so forth doing the treatment are now becoming victims of the virus themselves, and we've had a warning from Sierra Leone saying that the healthcare infrastructure's under pressure. Is there a serious possibility of the people dealing with this now being its victims and rupturing the healthcare system?
Well, those who are treating the virus were always going to be facing the risk of being close to those who they're trying to treat in the first place. And it's unfortunate that they themselves are being affected, but it does shows you the complexity of the sort of virus that we're dealing with, but more so the fact that all these precautions have been taken, wearing something that's close to space masks, wearing all these sort of clothing to protect them from the virus, and sometimes isolating the individuals themselves. Again, the virus creeps up. The concerns are right now with this drug, ZMapp, which has been offered to the Liberians in small numbers, we must say. Who's to say who should benefit from them? Naturally, health practitioners are being offered the virus first, in terms of the treatment, that is. But ultimately, there are many people in Liberia who would want access to this drug, and more than likely, they're not going to get it.
And who and how decides that? Because, I mean, you know, with limited supplies, experimental drugs, who is it who's making the decision? Who's getting it first, and who's going to wait and possibly lose their lives because they're waiting?
Well, there's always going to be ethical concerns in a crisis like this, but we are in crisis mode, and I think ethical concerns should go outside of the window. Naturally, first emergency respondents are those who would need access to those drugs because they can get well and actually help others. Secondly, I think a lottery system is what will have to ensue, where everyone will be placed in a hat, and a computer of some description would pick out those who would benefit.
Well, that's interesting. Is that actually what's being decided, or is there some kind of healthcare panel, or is there anything in place yet?
There isn't a plan. There isn't a plan. But I'm envisaging that if at all this drug is going to be mass produced, more than likely a lottery system would have to be put in place so that everyone has a fair chance of getting access to what clearly could make the difference between surviving or dying.
And do you think that that's a preferable idea, perhaps, rather than healthcare professionals saying, because perhaps there are some judgments which might be that, you know, applied to this patient they're more likely to survive, applied to that patient they're not? So is there not, if not an ethical dimension, a practical medical decision to be made here, choices?
Well, that's one, but we must remember that the drug itself is not a cure. That's why it's in experimental mode. We've already seen that there are 2 patients in the US who've tried it, are getting better, not cured, and we already have a priest who's tried it, but literally died. So clearly it's a hit and miss at the moment, but when you're in crisis mode, when you're in an alarming mode, when you're in a mode where you've got no other cure to help those that are in need, then you have to offer something, and at least been shown to do so. And I think that's where we are. We're in the mode of at least trying to do something in a very desperate situation right now.
So Germany said to its nationals to get out to the affected areas. Is that a sensible response?
Of course, it's a sensible response. It's a practical response. And I think this is where the practicality of all the responses worldwide have got to be taken, which is why those who are meeting in the Hajj this week have really expressed concerns that a massive meeting of Muslim leaders and clerics from around the world were meeting on that day or a series of days. They are concerned that those that are coming from more problematic areas in Africa for which the virus is already spreading may put others at risk. So yes, practical steps, being real with what the virus is capable of doing, but having practical steps that can be put in place, hopefully containing a potential outbreak.
So what could be done here? And indeed, what was discussed at the meeting in Saudi about this? Because I mean, you've got a mass of humanity coming together in precisely the conditions where the virus spreads. Will there be a test of people coming in to see if they're carrying it? Will there be quarantine? What do you think will happen?
I think it will be a combination of many, many practical ideas. It will be visa bans, it will be isolation, it will be systems in place to contain those who are likely to be affected, but also preventing travel from problematic areas, I think, will be imposed as a safety measure to those who would want to go in and experience the Hajj itself.
Is there a way in which, perhaps after terrible human cost, the virus will, if you like, run to its limit? I mean, even before there were cures for plague or it was eradicated, that's what happened to outbreaks of plague. Is that what we're looking at as the only end of this?
Well, the plague is a very, very good analogy there. But the reality is that even when this virus first broke in 1976, of which we've had close to about 18 different episodes of the virus itself over time, it's sort of found its way out of the system. But we've had smaller numbers to deal with, we've had smaller affected areas. This time we're dealing with such a huge land mass, we're dealing with many, many millions of people, not to mention thousands who are already affected. And again, it makes the virus that much more complex when we are dealing with an area where people can travel very, very quickly from parts of the country to other parts of the world. And there's alarm. And I think there's concerns that why is it that the virus, which has been around since the 1970s, has not been taken seriously enough, or to have had a multiple of treatments available to deal with those who are likely to be affected. Does it have to take a European life or Western life to demise or be found themselves affected by this virus for the West to take the virus seriously? We're dealing with an African continent for which healthcare services are at rock bottom, and the infrastructure is clearly not there. And of course, those countries will suffer and struggle, which we were seeing in places like Sierra Leone and Liberia, who've already put their hands up to say, we've got a problem.
Well, some people are saying exactly that in a society that had a more sophisticated healthcare system, a richer society, this scale of spread wouldn't have happened. Do you think that's true?
Well, the containment would have been slightly different, but in terms of stopping it, I don't know, because really the jury is out as to how Ebola has been created in the first place, how it comes about. There are all sorts of reasons behind it, and no one really has put their finger on it. So yes, determining the source, identifying how it spread from person to person, we already know about contact, but the speed is what we're talking about. Speed of movement outside of what we're capable of containing, and ultimately not having a known serum to treat the virus. That's the concern.
OK, well, we have to leave that there, but we're going for our first break in the evening now, but do rejoin us for part 2 when we'll be looking at the rest of the day's news.